Ingenio, Secretary General of OFW Congress. A round of applause. Being a member, a supporter of OFW Congress KSA is truly a gratitude. An expression of gratitude is, I would like to express it right now because truly without OFW Congress, this one will not be made possible. And now, for the welcome address, first let us call on Dr. Fahad Alakil, Director General of CARE National Hospital.
His Excellency Ambassador Adnan Alanto, our guests, my dear and CARE National Hospital family. Assalamu alaikum wa rahmatullahi wa barakatuh. It is my pleasure really to welcome you all in CARE National Hospital, the first private hospital established in Riyadh City in 1967. This hospital, which grew over the time and currently becoming one of the top largest healthcare organization in the kingdom. I would like to thank His Excellency Ambassador Adnan for accepting this invitation despite his expected busy schedule. I would like to thank and really congratulate OFW Congress for this great idea they are working for. And it is not only idea, they make it a truth. I would like to take this opportunity really to thank all CARE National Hospital Filipino employees for their hard work and commitment and over years and years growing with this hospital. And a special thanks during the difficult COVID time. Actually, you have shown that in dark time, the Filipino can shine. Thank you all and wish you a successful event.
Thank you, Dr. Fahad Alakil, Director General of CARE National Hospital. And for another welcome address, I would like to call on Mr. Muhammad El-Kisayer, Chief Human Resource Officer. Let's give him a big hand.
Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening, everybody. Just I would like to thank you to coming, and also like to thank the Ambassador for coming again to CARE. I would like to thank all the people who participate in this event to make this happen. There is nothing to say more than thank you for our hero nurses from Filipino that we are proud to do the job that you're doing through all the year, also especially in the pandemic corona. Thank you again. I wish you all the best, and always we are proud of our nurses and other staff. Thank you very much. Thank you.
Thank you, sir. Thank you, Mr. Muhammad El-Kisayer, Chief Human Resource Officer. At this moment, I would like to call on the Director of Nursing of CARE National Hospital, Ms. Flor-Deliza Africa Canlapan. Let's give her a round of applause.
His Excellency Ambassador Adnan Alonso and Mrs. Alonso, Dr. Fahad Alakil, our Acting General Director, Mr. Muhammad Al-Sigayer, our Head of HR Chief Officer, Mr. Muhammad, our Head of HR, Ms. Laila, the Head of PSD, Dr. Isam, Head of the Emergency Department, all our guests, all my peer nurses, all our Filipino workers of CNH. A pleasant evening to all. It is a pleasure to welcome everyone for this very, I would say, historical event. It is, in my many years of experience in Saudi Arabia, I think this will be the first time that we will be receiving recognition as nurses or as Filipino nurses. So, last July 7, I received a call from one of the officers of the OFW Congress Riyadh requesting a meeting to discuss their intent of awarding the CNH OFW Filipino Frontliner Heroes. So, the planning started. This event was made possible with the invitation of our dear HR Chief Officer, Mr. Segayer, in coordination with Mr. Rene Layo. So, in collaboration with the Philippine Embassy headed by His Excellency Ambassador Alonso, now here we are. It's a dream come true. This is the big event. So in behalf of the overseas Filipino workers, frontliners of this hospital, may I then take this opportunity to thank you all for the heroic gesture of awarding our frontliners, heroes, workers of this hospital. The term frontline worker often conjures the image of a doctor in a hazmat suit or a soldier in a uniform. But during the coronavirus outbreak, which started last quarter of 2019, workers across vast array of industries have found themselves an essential part of the fight against COVID-19 pandemic. They were required of their jobs despite risk, whether they are housekeepers, whether they are bus drivers, secretaries, nurses, technicians, social workers, pharmacists, lab technicians, and so on and so forth. So the emergence of the coronavirus has affected our frontline workers psychologically and mentally. We knew that they could develop fear, anxiety, depression, feeling of lack of support, feeling of rejection, increased level of stress. We have a total of 200 nurses in this hospital. And we have also other workers that are not nurses. So what was the role of the management of CNH? How did we respond to this? Psychological fear, anxiety, depression. The CNH management organized a special team headed by the Director General during that time in 2019. How did we manage the frontliners' fears? We prevent staff shortage. We did urgent recruitment and we were able to recruit around 100 nurses at that time from India. Nurses were assigned to the COVID unit and frontline units were given hazard payments. Well compensated overtime, understanding and addressing their anxiety. By how? Regular communication with them. They were provided a tablet, free Wi-Fi as a means of communication. Our infection control at that time was available for 24/7. And any help required, they can always knock at his door. How did we address their feeling of being alone and feeling of rejection? Education of our hospital workers and informing them the great job that each of them has been doing. Regular rounds, you don't believe, of the Director General to the COVID units and saying hello to everybody who were affected with COVID-19. All the nurses were being addressed, all their problems have been addressed by our Director General. We made sure that they feel that we work with them, very important, that they see us all the time as their leaders. And how did we assure them that they are protected from the virus? Isn't it? We have very tiny nurses, very tiny, 4'11", 5 feet, weighing only like 55 kilograms, I mean. So how did we take care of them? We provided them enough appropriate PPEs. We provided them training on how they're gonna wear their PPEs properly, on how they're gonna protect themselves by proper hand washing, masking, social distancing. We provide them all of this coaching. A permanent staff mirror was provided in the COVID unit so that proper wearing of the PPEs is always adhered to. There is also regular checkup done by the pulmonologist in the unit for all the staff. And how did we help sustaining their well-being? We provided them nearby accommodation. We provided them free food and supplies for daily consumption. It was not the best that we can provide, but we would like them to feel that we really care for them. And how did we support them when they got sick? It's a free treatment. Enough sick leave is granted. How did we boost the morale of the frontliners? We provided them recognition. We organized awarding of everyone who were on the front line. And how did I address as the Director of Nursing their social needs? Kasi hindi po sila papayagang umuwi. What I mean is, they were not allowed to go home because of the pandemic, intentionally or non-intentionally because of the flight problems. Kaya na-stuck po sila and they're not able to go home. So, with the simple gestures that we have with our team in the nursing department, we organize a lot of activities. And with the full support of the Director General, we organized activities as a form of outlet of their boredom, of their anxiety, of their homesickness, because they're unable to go home and see their family. Local holidays were granted appropriately. International leave later on was granted accordingly. Nursing events were organized. We did the first virtual Nurses Week. We did a monthly Employee of the Month in coordination with the patient experience. We celebrated bonggang-bongga pong celebration ng Independence Day. It's the first that we have done, and even the first that I have done for the many years I've been here in Saudi Arabia. And everybody has enjoyed it. Team building outside the compound. Mga 20 lang nakatao po. Pupunta kami sa Tiraha for team building. And that is how I'm gonna, make them feel better. I am truly inspired by the strong commitment of all of us and during the challenging times of pandemic. Our care given to COVID-positive patients was an approach that embodies our standard of care regardless of race and religion. I am grateful to all of your contributions during the real difficult times. Amidst this pandemic, we Filipino workers stood resilient and committed, and we all deserve today's award. Maraming salamat po at mabuhay tayong lahat.